This is the news in brief from the United Nations. While some of the world's poorest countries and communities welcome refugees with great hospitality, the international community must match their generosity with far greater solidarity, UN Chief Antonio Guterres said on Friday. Speaking at the closing of the Global Refugee Forum, Mr. Guterres said that protection and help for these most vulnerable of people was an obligation shared by all of humanity. He stressed that resources to support them are under enormous strain, especially in the Global South, which bears a disproportionate burden in hosting refugees. At the forum, co-hosted in Geneva by the UN Refugee Agency, UNHCR, and Switzerland, the UN Secretary-General welcomed the pledges and commitments made by countries and the private sector. These will help refugees rebuild their lives by improving access to education, healthcare, social protection, housing, employment, and participation in public life. In his video remarks, Mr. Guterres also highlighted the need to tackle the root causes of displacement in line with the 2018 Global Compact for Refugees, including the devastating impacts of climate change, poverty, and conflict. Protection needs for children in emergencies from Ukraine to Gaza and Sudan have never been greater, but the humanitarian funding forecast for 2024 is increasingly bleak. That's the message from the UN Children's Fund, UNICEF, whose Deputy Executive Director for Humanitarian Action and Supply Operations, Ted Chabon, said that flexible funding for aid is shrinking. At the same time, attacks against humanitarian actors around the world have surged. Children should not be paying the price of our inaction with their lives and their futures, Mr. Chabon said, stressing that youngsters need continued access to essential services, including healthcare, safe water, basic sanitation, and education. Earlier this week, UNICEF launched a $9.3 billion emergency funding appeal to reach close to 94 million children in 155 countries in 2024. Mr. Chabon said that this year's ask was only about 50% met and listed a number of critically underfunded emergencies. These include Sudan, Burkina Faso, the Democratic Republic of the Congo or DRC, Myanmar, Haiti, Ethiopia, Yemen, Somalia, South Sudan, and Bangladesh. A lack of resources means that choices will need to be made regarding a number of essential interventions, including immunization, primary health care, treatment against severe acute malnutrition, psychosocial support, addressing grave violations against children such as recruitment by armed groups, and education, which is also a life-saving intervention in emergencies, according to UNICEF. A deadly mpox outbreak in the DRC has been rapidly spreading across the country, raising concerns of international transmission, the UN Health Agency WHO said on Friday. Over 13,000 cases have been reported through mid-November, with over 600 deaths, including in 3 provinces not previously affected, WHO said. The UN Health Agency reported that the strain of the virus responsible for the current DRC outbreak, called Clade 1, is more virulent than the predominant strain in the 2022 global outbreak, Clade 2. The DRC outbreak outpaces the global mpox case fatality ratio 4-fold, and up to 9 times in endemic areas. Human-to-human transmission in areas in which mpox is endemic is accelerating, and 70% of cases there are in children under 15. Concerningly, the DRC outbreak has seen the first reported sexual transmission of Clade 1 mpox, and WHO warned that it is now moving through sexual networks that include male and female sex workers and their clients in areas with high population mobility. The crisis is further compounded by the fact that the DRC is simultaneously facing a cholera outbreak and a protracted humanitarian emergency driven by armed violence and mass displacement. WHO has been supporting the DRC Ministry of Health with the detection and confirmation of cases, as well as ramping up treatment. The country does not yet have access to mpox vaccines, and work is being done with the health authorities to develop an immunization strategy and help move towards vaccine approval, WHO said. Dominika, Tomaszewska-Mortimer, UN News.